I haven't posted an update since my last chemotherapy appointment, and I'm just making a little video because I think that it's easier to talk about some of the things that people might like to know right now. I think a lot of people in this world have been through chemotherapy. Obviously they have, but until I had to go through it, I knew nothing about it whatsoever. And all of a sudden, I was torn out of my normal life, and I had to make the decision about whether or not I was going to go through some chemotherapy and radiation and surgeries in order to try to save my life. And not everybody in their lifetime is going to have to do that. However, most people in their lifetime will go through something incredibly challenging. So right now I'm just kind of trying to look at everything through a positive lens, or as positive of a lens as I can look through, and I'm planning to do well with this. So as for the chemotherapy, what I had to do on that first day was pretty scary for me. For some people it might not feel as scary, but I don't know. I'm not gonna lie. I think every single person would have a little bit of fear inside of them, because when you think of chemotherapy, even if you don't know a lot about it, you know that it involves medications that can make you feel very ill. And from my experience up to this point, I feel that I've been doing better than I expected. So that makes me really happy. The more chemotherapy treatments that I have, that's just Meadow flying around. I use her as a little emotional support bird sometimes. She's really, really sweet. But she makes a lot of noise. So anyway, the more chemotherapy appointments that I have, my fear is that I will probably feel a little bit sicker and sicker. I don't know that for a fact, but it is something that could happen. It is a possibility to get pretty ill. Now, up to this point, what I'm super happy about is that I can still teach. So I've already had 2 days after my chemotherapy appointments that I was able to teach with my high schoolers, and you know, I'm trying my best. Maybe I'm not totally on point on my A game, but I'm doing the best that I can, and I feel like the kids have been so amazing. I absolutely love them so much, and I am unbelievably overwhelmed and in awe with how much support I've received from former students and current students. And so that just makes me feel so incredibly good. And I have no doubt in my mind that I'm doing as well as I am doing with all of this because of my students, and even more because of the staff members at the high school who've been so kind, and because of my friends and family, people that, you know, I thought maybe didn't care one way or another about me. They've really made a big difference in my life with the situation, and I'm so thankful and so grateful to everybody who's had kind words. And you know, we did start a GoFundMe page as well, and that's quite a bit because we don't really know what is in store for the future right now. Jonas has had to take off of work, and well at his school job, but he can use his sick leave for that, family sick leave, family related sick leave. But at his other job, he has had to drastically cut down on his hours for me. And so that was, that's going to be a little bit rough. I'm not saying this to entice or promote the GoFundMe. I'm just saying this so that you understand why we did make a GoFundMe page, because it is pretty hard for anybody. Well, for a lot of people, it would be hard to not be at your job all the time when you want to be. Yeah, I do want to go to work. I want to be there with my kids, but I have to do all of this instead. And that requires us driving back and forth, using gas money. I'm supposed to be eating foods that I usually eat, but I'm supposed to be eating better than I have been eating, and you know how the world is today. That costs a lot of money. So there's also something that I had to do during chemotherapy, which I want to get into a little bit. But in order to try to save my hair, I have to buy what is called a cold cap. And the cold cap that I have purchased with actually the GoFundMe funds, that is a cap it's $2,600. There are ways that you can get this paid for if you are in a certain income bracket, and in very, very, very high financial need, but not everybody fits into that category where they can get help or can get a lot of assistance for it. So my insurance company did not pay for it. They don't consider saving a person's hair as a necessity. And to me, I have a lot of feelings about that. Not so nice feelings about that. And I think that the medical community also is a little disappointed that most insurance companies do not cover the cost of the cold cap, and it doesn't always work. So I am at a greater risk of losing all of my hair because I have to take more chemotherapy medications and harsher chemotherapy medications than some women with breast cancer or some people with other breast cancers have to take. So because of that, the cold cap has a chance of saving some of my hair, maybe half of it. There might be just a wonderful surprise and all of my hair may be saved, but I'm pretty attached to my hair. So for some of you, you might not think that that's a big deal, but for me personally, my hair has been a great friend to me over the years. And I don't know, if I lose it, I'm just gonna have to do something like wear a wig, probably. That is the great thing about my insurance company, is that they do cover up to $1,000 for a wig, possibly multiple wigs, I'm not sure, but wigs are really expensive if they're decent quality. So the one that I will be getting just in case I lose my hair is close to $800 for one that's the same length and a similar look to the hair that I do have right now. So that's a lot of money. And then plus there are some additional costs with that, like special shampoo that you have to buy for it. And I don't even know what else exactly there is. There's some bands that you can put underneath your wig to make it stay on better. But I'm not thinking about that too much yet because so far I do have my hair, with the exception of after my second chemotherapy treatment, which was today, I blew my nose. This is kind of weird, but I blew my nose and I noticed that my nose hairs started falling out. So that was a pretty big surprise to me. That's another thing I never thought about. I knew some people lost the hair on their head, but I didn't realize that I may just lose my eyelashes and my eyebrows and hair on my arms and everywhere. So we will see. We'll see what happens, but that's kind of sucky. It's sucky. I mean, there's not a lot that's good about that other than I maybe won't have to shave my legs and my armpits for a while. So, so that's interesting. Yeah, so there are a lot of expenses that come along with cancer. I never thought I'd say that. I never ever thought that I would have this, ever. I thought that I could get a lot of different diseases and have a lot of different problems in my life, but cancer is not one that I ever thought that I would get, especially at a young age. I just hit my 40s not that long ago, and for some people, you might not think that's very young, but most people who I know who have gotten cancer have been family members who were in their 80s, 90s, mid-50s at the very earliest. So it's kind of a shock to me for me to get this so young. And it is what it is. I've got to keep going, and I'm going to keep going, and I hope that I make it through this. I think that I will. I think that I'll survive this. But it's just really hard in the moment. And also, I will be considered, if I make it through this, which everyone thinks I will, I hope that I will, but when I make it through this, I will be considered cancer-free. However, I'll be in remission for 5 years. And then there's still the possibility of the cancer coming back. So I really hope that that will not happen, but it is a possibility. Now, kind words, that is what's getting me through this. It has nothing to do with donations or money. I'm so thankful for those things, beyond thankful. You can't even imagine how thankful I am for donations. But the words of people around me are really what is helping me out the most. And I thank you so much for that. I'm really grateful. Jonas is incredibly grateful, and he is the biggest rock star. He really, really is. He's helping me through this so much, and he needs to be taken care of too. He and people have been so kind to him, and their words have helped them so much as well. So thank you for taking care of him. He's such a good, kind soul. He's such an odd, wonderful, weird, kind soul. And he's helped me a lot. So, yeah, I know this is getting kind of long, but I've got to say what's on my mind. So I think that some of you might be interested to know about some more of the side effects of chemotherapy. She's very happy. That's why she's making that noise. So some of you might be interested to know about what side effects I'm having from chemotherapy, and you might be able to tell right now as I'm talking, my voice sounds a little bit more raspy than normal. So I do have a very, very dry mouth. I find it a little bit harder to not necessarily talk, but just because I have such a dry mouth, it is a little bit harder to get my words out as loud as I would want them to be. One of the yuckiest, just not fun problems I've been having is having a little bit more difficult of a time walking. And I never would have imagined that I would feel that way, but my legs have been aching, my ankles, my knees, and my hips, even my thighs have been hurting. So I've been having some muscle pain and actual joint pain. And I've discovered that that's actually very common. When you're going through chemotherapy, your bones can hurt, is what one of my nurses said. So there are some things that I can do to help with that, but it's hard to feel healthy one day and then the next day just, you know, you can't get up and walk around like normal. I can walk. It really is off and on, but when I'm having a hard time, it's pretty hard. So that's something I never anticipated. I would say fatigue really comes and goes for me right now, and I don't know if that's going to increase. I don't know if I'll have increased fatigue. I may, and that makes me a little nervous because I want to keep teaching. Really, really, really super incredibly bad acid reflux. That's this, I'd say that and the joint pain are the two hardest things for me right now. So I've had acid reflux before in my life, but this is on another level. So I have to drink like milk all the time, and I never did drink a lot of milk. I don't really like it, but it's one of the things that soothes my acid reflux. A lot of people get that, but thankfully I haven't had it a lot before. Now I do. Hopefully that'll change though. Other things, I can get some blurry vision. No, it's not bad though. It's not bad. I was scared that my vision would actually be greatly affected by this, and so far it has not been. So I'm doing okay there. Just a little bit of the blurry vision, and just little things like stomach cramps, stomach pains. I have to get blood work done every time I get chemo to make sure that my liver is okay and that my body can handle all of the medication. And so far that's been going okay. I wrote some of these things down. I can't think of the other things that are bothering me right now, because those are the big ones, the joint pain and the stomach issues. And the stomach issues are so common for this. I do have to take anti-nausea medication every 6 hours. And from the moment I wake up in the morning until before I go to bed. So I don't know what I would feel like if I did not take that medication. That makes me nervous, so I'm just gonna keep taking it and hopefully never get nauseous, so I'm not vomiting or anything like that. Yeah, there's a lot of stuff. I do get slight hot flashes, so I'll get kind of, if my stomach is hurting, I'll get pretty hot and just won't feel very good. Oh, and I have rosacea. My cheeks get really red. That's just an inherited issue that I have. But it does flare up more with this, so I might be walking around with a beet red face, though you might not be able to tell because I have to wear my mask now as well, since my immune system is compromised. So I think those are the big side effects right now. And again, everybody's experience is very individual. So if you have to go through this in the future, or somebody who you love goes through this in the future, they might have different experiences. But what I did learn is that the chemotherapy now is so much more tolerable for so many people, so many more people than it has been in the past. And that's wonderful. In the past, a lot of people would have a lot of bad issues. And I'm thankful that I didn't get this, 5 years ago. 5 years ago, the cancer that I have, they didn't know as much about it. And so they know more now, and they know that chemotherapy is good to treat it. So that's great. As for actually going through the chemotherapy at Mayo Clinic, they're phenomenal. They're absolutely amazing. I feel really well taken care of. I feel like most of the people who I have encountered there have been kind, caring, and they have made me feel better about going through this. So I do suggest, if you're able to go to the Mayo Clinic, go there. I am lucky enough to live near Rochester. In Winona, we are lucky enough to live near Rochester. And I'm so thankful for that. So incredibly thankful. Meadow really wants to talk. This is, her name was actually Kevin, and she's one of the many rescue animals who I have and have had over the years, but she has some issues with her legs where she can't walk correctly. She can still walk a little bit though, but she is just a beautiful angel. So she keeps me company through all of this. But yes, I know that I'm not the first person to have cancer. I know that I'm not special because I have cancer. I'm just sharing all of this information because I want my friends, family, and any students who care to watch this to know a little bit more about breast cancer in general. And this may it may help somebody else someday to hear that, oh, this person went through this and they survived. And, maybe 40 years down the line, maybe I'll still be alive. I do hope so. I think I have a lot more to do in this world, a lot more to accomplish. I have a lot of goals, but I think that I'm going to make it through this, and I just want to help others if they watch these videos or read this information on Caring Bridge. I think it could help someone. So, and it's helping me to get this out there and to share this info with others as well. So thank you for listening. And I know the video is really long now. It probably is going to be 20 minutes. So I'm sorry for that. Okay. Thank you for listening again.